And good morning, everyone. This is Christopher D. Grife. Hope everyone's doing well with this lousy weather we've been having today. Once again, I want to welcome everyone to the Brooklyn Family Support Service as we, celebrate a little fireworks to keep everyone's spirit up. As you know, we do start at 10 o'clock. The time is now 10 a.m. Welcome to the Brooklyn Advisory Council Special Outreach Update, which we have a lot of information for today to give you, so be prepared for everything. Before I start with anything, let's start with the housekeeping rules. That is very important. So therefore, for the computers or tablets, or some people might be on their cell phone because they can do it by screen as well, remind you that please make sure you follow your chart noises as well, that you follow that number one. As you see, everyone should be on mute right now. On the computer or tablet, you should have the button near you called the mute button, which is right there in the bottom. But also before you always start is an order button that turns into a microphone. But I always remind you, your mute button is where your microphone is, mute or unmute. This is only for the computer and tablets or tablets. Remind you, the mute or unmute button is available, but it also reminds you where it is. The video camera button is also available on the start button. So therefore, once you click that camera, then we can see you. If you don't want to show yourself, you can leave it off. The choice is yours there. Also, if you have questions to raise your hand, please click on the participant button that has a number, click on it, and then you will see a picture of a hand, this hand. That's right, folks. The hand means raising your hand, and I will see that. Also reminding you, if you have an announcement, please hold your announcements until later on so we can get everything done quickly and get everything done. We know it was raining today. It looks like it's clearing up, but we'll make sure we keep on our good spirits today. Now, for the phone people, we have two people on the phone. Please listen very carefully as I remind you there are two things. If you want to speak, please make sure before you do that is star six to mute, star six to unmute. Again, star six to mute, star six to unmute. But before you do that, star six, please make sure that you press that. And on star six to unmute yourself right now. So please mute yourself so no interruption comes in. Okay, now that's right now. I am going to remind you, please mute yourselves right now. Star six is to unmute when you're identifying yourself. Now, if you have a question you like to make, please make sure that you do the very important piece is to star 9 is to raise your hand. Star 9 is to raise your hand. Once identify you, that phone number, by then, star 9, you can then unmute yourself on star 6. This is the only time if you have a question. At this moment in time, I am going to remind you to please mute yourself. So I am muting you, whoever's 347-564-3743. Mute at this time. So it is very important that we make sure everyone pays close attention of the housekeeping rules. It is very important so we can follow, so we can keep the meeting on schedule and more respectful for anyone else who is speaking so we don't have any interruptions. You can hear me, but I cannot hear you. The only way to do that for the phone people is to star 9 to raise your hand, and I will identify you. And then you can press star 6 to unmute. So please follow very carefully. And the hand will be shown again, as I said before. Now, again, I want to welcome everyone today. First things first, we do have a lot of things we need to cover because there are a lot of things that we have good news, some news that we still have to keep advocating today for the September and October, and we need to continue doing that. So it is very important that we must work together on this. And as I know, a lot of people are coming on a little late, but that's okay. But guess what? We're just starting now. Now, before I do anything, is Angela Blades from the Brooklyn DDR in yet? I'm gonna guess not. Okay, Angela was one of Miss someone from the DDR was supposed to be here to give us some additional updates on the 507 plan and some other plans that they've been discussing. We hope that she does pop in, but at this time also, we're going to move on to our agenda, which will be Miss Deborah Greif, will be giving you guys a update on the other things that are coming up. Sorry for a little computer. Miss Deborah, you're next to me.
I'm here. I'm ready.
Go ahead.
Good morning, everybody. Thank you for all joining us. I'm going to keep this brief but to the point. Okay. First of all, as you see on the screen, and if you don't have it, I will read it too. You'll see an SSDI and SSI disability benefit cards. Now, we're not showing the numbers, but Medicare, we want everybody to know the difference because a lot of people claim they have Medicare when their card really is a Medicaid card. The Medicare card is red, white, and blue, and no longer will have your Social Security, I mean the individuals, or the Social Security number that the individual is collecting under, which means it could be the mother or the father. It is usually the higher wage earner. So no more Social Security numbers on the cards. This causes less form of fraud or theft, or is the most important, identity theft. Now, Medicaid card is blue and white. It has a picture of New York State on it because it says New York State. This is a Medicaid. It is issued. You can still get SSI, and you do get SSI disability benefits, but New York State with the federal do work to cover those benefits. We're not talking about Medicaid waiver at the moment. We're just talking about the differences between the two cards. There's another important thing I want everybody to understand. If you have a red, white, and blue card, that's the Medicare health insurance card, you can show that to a bus driver and put the $1.35 in, but it has to be your card with your name on it. That's for the individual. Or the same thing with the train. And if you don't have a Metro card, they will give you a return receipt, and you can pay if you're at a booth. Go to one of the express stops like Kings Highway, and it's example, and they can help you with get a Medicaid. Okay. But remember, the reason why I'm bringing this up is I don't know how many times people say to me, I have the Medicare card, and I've been online for the Metrocard vans. I've been on, waiting to put money in the card, or, I've been at and I'm trying to get there, and people say to me, I have a Medicare card. And I said, well, and they're playing, I'm having problems. Okay, please take your card out, show me. And what do they take out? The Medicaid card. I said, you don't have Medicare, you have Medicaid. SSI does not give you Medicare. You would have to be on SSDI when you first get on 24 months before you get a Medicare card. And that is something you must remember for the individual, as well as any of the parents who are become disabled or retire. A Medicaid card is not the same as Medicare. When you have Medicare, it pays 80% of your medical bills when you're officially on, and Medicaid covers the rest. So with that, okay, go on to the next one. Okay, now we have some good news of reference, good and bad news, but SNAP updates, temporary increases in SNAP end September 30th. Okay, SNAP is what you used to know as food stamps. The temporary 15% increase in SNAP benefits that went into effect January 2021 is slated to end at the end of September 2021. OT, OTDA expects, though not yet confirmed, that there will be a 5% increase in the Thrifty Food Plan, which will partially offset the decrease in SNAP. If this is the case, the actual decrease in SNAP benefits will be 10%, and this will affect all SNAP recipients. An updated version of the Supplemental Nutritional Assistance Program SNAP training is available in the SLMS training for detailed instructions on how to access the SLMS. Visit the SLMS reference page on the OPWDD website. Questions about using the SLMS can be referred to Talent Development and Training at, and this is the email, all lowercase, talentdevelopment@opwdd.ny.gov. Now, I want to explain something. The Biden administration has said that they're going to keep so before everyone was only getting 204, they said that they're going to keep like if you're getting you're getting 234, they're saying you'll keep it or just a little bit lower, not too much, and they're rethinking everything because of the Delta variant. Okay. Now, school. Well, let me put it this way. You can please go on as you see, whoever can see it. There is on the school, New York City Department of Education. They have Homecoming New York City, our classes, our community, our future, safe and healthy learning for all, back to school. This is the 2021. And they have the school year. They also have, you can go on there is https://www.schools.nyc.gov/schools hyphenated year /school year hyphenated 2021.
This also has special ed stuff, and it does have, just to let everyone know, this information is also on our website.
Yes.
So please make sure you visit the website with the school ideas, because they do include special ed as well. Chris Treva has been urging every councils and every borough, as well as CCOs, please make sure if you know your student is going to school, please make sure they pass this to your families. This information is attached to it's also on our website.
Okay, next slide, please.
And I do need to remind people, reason why, if you're, okay, before we continue, someone is,
Can you please
okay, I have to remind everyone, please keep yourself on mute. It is because we are passing this information. We need to follow through.
All right, there is a new back to school season. You have rights. It's a fun and informative activity book for kids that celebrates the rights and protection of all New Yorkers. Download your copy today, and it's at https://bit.ly/ and all you have rights.
Well, this is a booklet.
This is a booklet, and that it will give you information about your rights as a New York citizen. Go ahead. Or resident. Now,
everything that Ms. Griff's saying, go ahead.
Everything we're saying, and there's also another thing I didn't bring up. The ARC, nationwide in New York City, it's known as AHRC. They're doing, we're all advocating, so we need you to contact your city, state, and federal official representatives. For this reason, we want to make sure that they update and change update mostly the Social Security laws. They need to raise the income threshold so our individuals can eventually go to work if they're capable and want to. but also it will help more families because too many of our individuals are living in, people with disabilities do live in intense poverty and they need more help. Also, you need to contact all of our elected officials. They're very important because this year in New York City, where there's a mayor contest, there's a mayoral race, there's a, or also your local city council, your we have our
Some of the state senators.
controller, the New York City controller. We also have our public advocate, but we also have some of the state of offices like your assembly or your state senate. If they've changed to decided to run for a different office, you need to check if now they're on. We do have it on our website, so you can easily find out who's running or what position they're in, but also let them know. The other important thing is to make sure that they see that the Medicaid waiver and the let me say this correctly, that our direct care professionals are paid a wage that's not minimum. The job that these wonderful people do is not minimum wage. This is not using a going to McDonald's or Burger King and flipping burgers. This is not. What we are asking everyone is that please make sure that the workers that are working with their children are paid correctly so that they can stay working with their children. So that's a very important thing. Go on next.
Actually,
Okay.
we're actually going to skip. We're going to actually hold on to this. But as you know, family support guidebooks are available on our website. That information is available, and we'll discuss that after.
Okay. So as you see, we just want everyone to know we have updated our website. We have put on, as you see, I'll read it for the phone people. Helping Families with Developmental Disabilities in Brooklyn, the Family Support Service Advisory Council website. Our features have been updated in the website. We have the BDRO/OPWDD/COVID-19 news updates, role of council, service openings, events and training, transportation, learning, advocacy. Okay, please stay
Guys,
mute.
yeah, guys.
Mute.
Okay,
Please mute because I have to stop them.
okay, continue.
Okay, you can join the meeting of the Brooklyn Family Support Service Advisory Council and the Brooklyn DD Council. The BFSS Outreach Update Brooklyn DD Council Subcommittee. We have also the 2021-2022 Family Support Guide Booklet, and we have much more. Also, we want everyone to know there's a new location for the Brooklyn DDRO. It is now 750 Vandalia Avenue, Brooklyn, New York, 11239. You have our website, which is www.bfssac.com, or you can email us at bfssac@yahoo.com, or you can leave us a voice message, 718-642-8512. We ask, please speak slow and clear. Repeat your phone number twice. Also, it's very important. We need to know your name. So please, we'd appreciate that very, very much. So, and also, I want everyone to know we will not be meeting until the end of October. And that includes the Brooklyn DD Council. We are still doing everything by video, virtual, because we found it's easier, as it says here. There is no meeting in August or September. Anyone who is celebrating Jewish New Year holiday, we wish everyone a sweet, happy New Year, but we are not meeting in the month of August or September. This was an emergency, which will be explained in a little while.
This is special.
This is a very special one.
Yeah.
Right?
But just want to remind everyone, the next meeting for that joint meeting is not until Wednesday, October 27th. We ask everyone to please try to get on at 9:30 so we can start the meeting by 9:55. As a reminder, we like to try to start on an on-time schedule meeting. So this is just a reminder. Does anyone have any questions for Debbie on any of the reports she has?
Okay.
Okay, if you do have a question, you're not sure, you can ask her later. Who's this?
Angela.
No, hold on.
Who's this? Hello.
Hello? This looks like Maria. I cannot.
Hi. Hi, how are you? My name's Maria Arboleta. I'm
Yes.
from One Guys Project Intervene.
Yes, you have a question?
No, I don't have a question. I just joined into the session.
Okay,
Yep.
but I just want to remind everyone as you're coming in late, please, this is just a reminder that at this moment, that if you have a question, please, 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 you can do two options. You can put it on the chat or please raise your hands as you are coming in. I did give this housekeeping rule for a reason because we do need to not interrupt or that. I am just giving you guys an reminder update. And phone people, again, *9 to raise your hand. Once I see your hand, I will remind you to press the *6 then. All right, you are right now on mute. You can hear us, but we can't hear you, and that is fine. So at this moment, since no one else has a question for Miss Deborah Greif, I am going to move on to Angela Blaze, who just popped in. Angela, you here?
Yes, I'm here.
Good
morning, Angela.
We hope you have been safe in this
Weather.
Hope nothing has happened to you or anybody you know.
I just have some brief updates from the DDRO.
Please go right ahead. It's yours to update. Thank you. Ready, Angela?
Angela, we can't hear you. You're breaking up. Angela, we don't hear anything from your microphone. Your microphone is on, but I don't hear a voice.
Okay.
Please give us a few minutes as Angela. Oh.
Okay. Hello?
Yeah,
Hi.
we're here.
We're here waiting for you.
I got kicked off.
Sorry about that.
Oh,
the weather is.
The signal must be acting up.
I just have brief updates for ODD. On June 24th, Governor Andrew Cuomo declared that the state COVID-19 disaster emergency has ended and lifted many of the restrictions that were put into place due to the corona pandemic. Also, with the DDRO, several things are occurring. We're merging a lot of our systems to be regionalized, which means that it's not just going to be one, like Brooklyn doing one thing. It's going to be Brooklyn, Manhattan, Queens, Staten Island. We're merging all the systems to make things easier for our families. So some of the waiver stuff will be merged. Eligibility is going to be merged. What else? Our front door is going to be merged. So it's supposed to make things easier for our families. What else we have here? Based on input received, OPWDD's portion of the initial plan for the map includes 4 main areas: improving OPWDD workforce, expanding community residential opportunities through an integrated housing pilot program, and providing incentives for the development of more integrated residential services. That's a mouthful.
Yes.
Are you good?
Okay, can you just explain the last part a little bit?
It's expanding community residential opportunities through an integrated housing pilot program and providing incentives for the development of more integrated residential services.
Okay, does that mean, I'm asking the question.
Hold on. I'm just reading a prepared statement.
Okay.
So for further explanation, you will probably have to check with Lucy O'Mazy or Nina.
Okay.
Strategic planning of the 507 plan. OPWDD is undertaking a 507 planning process this year. It's a comprehensive plan for the agency, setting directions for the agency for the next 5 years. You can always find regular updated information on OPWDD website regarding these things. As part of an effort, OPWDD also sought input from stakeholders about how to best use their one-time Federal American Rescue Plan Act funds. I'm not quite sure what that means, but hopefully you do.
Okay, I think I get it.
You're talking about, Angela, the 507?
Yes.
Yeah, it's every couple of years we have to do a 507 plan update.
There should be more updates
But right
by next
now-
month.
But right now everything is still new coming out.
I'm sorry, I didn't hear you, Deborah.
What I said is the updating and all the changes are slowly coming through because there's also been a lot of listening sessions OPWD has done with different stakeholders, from parents to professionals. Am I correct?
Yeah.
So
And
I know-
you can go on the OPWDD website for further explanations, and if you need to drop comments or, ask questions, you can do that on the site also.
Thank you. I appreciate that very much, Angela. Is there any other updates we need to know?
Workforce and recruitments. The developmental disabilities direct care workforce is the backbone of a strong service delivery system, which has made New York State the way it is. We're looking to hire more people. They're trying to compensate the staff as much as possible. In addition, not-for-profit service agencies have received a 1% COLA increase as part of the 21-22 budget. Let's see what else is here. It's a lot of information, and I'm just going through it to give you just the highlights.
Thank you.
The vaccine updates. We're still encouraging the staff to get vaccinated. If not, they have to wear the mask on site. And they may come that they might have to have testing, further testing, but we're encouraging everybody to get vaccinated. For the latest updates on that, you can go to the coronavirus health newyork.gov website for further information. Oh,
Bless you.
thank you.
You're welcome.
There's a lot of information here. HCBS waiver update. The federal CMS approved OPWDD's application for an extension of its Appendix F, which was originally approved in April of 2020. What else? I think that's basically it that I can see on this thing. There's a lot of information. And like you mentioned, we've officially moved over to the new site. It's beautiful, and hopefully we'll encourage our families to come in once it's safe to do so. Also, you did mention that I did update the family support guide. It was updated with the information that was given at the time. So hopefully it is as accurate as possible. If there are changes to be made, they'll be made for the next fiscal year. It's going to be kind of hard to keep going in and updating it, every month or so. So if you need to have it updated, just send the information to myself or to Henry, and we will try and plug it in. But please know, it's no guarantee that it will be completely updated until the next fiscal year. Do you have any questions for me?
Yeah, I have one question reference to the new building. Till everything is safe, if you have to come in, you still have to make an appointment to come in, correct?
I don't know about that. You'd have to talk. Excuse me?
Excuse me, I didn't hear what you said,
I
Angela.
didn't say anything. I'm
Oh,
listening.
no, I'm not sure about the appointments yet. I would have to check with Lucy with that. I can't tell you yes or no. I have not been given that guidance yet.
Okay, I appreciate the honest answer. And I'm glad to know that the building is new and everything looks really great here. And also, are they requiring, you know, right now, if you had the vaccine, whatever vaccine you have, and you have the card, now you have to carry the card with you to prove. Are they requesting that that you had the vaccine? If say you had to come in, are they asking you to show the proof that
I
you were
can't answer those.
vaccinated?
I can't answer those questions for you because I don't want to tell you yes or no. You would have to check with Lucy regarding that. I have not been told anything about that.
Okay, thank you. Does anybody else have a question for Ms. Angela Blades?
And Angela, just to add one thing before someone comes on, we have the screen up for you with the Family Support Guidebook.
Yes, I can see it.
Yeah, I'm just making sure. Just to remind everyone, the guidebook is located in two areas, at the OPWDD page and the service opening page. So the guidebook is available on those two pages areas. Please make sure you find out what services you're looking for. It is there.
Okay, do you have questions for me that I can answer as far as being the family support coordinator? I'm not overseeing, OPWDD and their services. I'm just following the guidelines that I've been given.
Understood. Does anybody have questions for Ms. Blades?
As far as having doing our normal reviews, we're still in the process of how we're going to do those reviews to go, visit the agencies and conduct those requirements.
Well, please keep me
When I
informed.
get updates, you will know.
I appreciate it. Thank you.
Angela, at this time, no one has any questions for you at this time, not even on the chat.
We looked
Okay.
everywhere.
So since no one has any questions for Miss Angela Blades, we want to thank Angela to give us all this lovely information, and
Which is very important.
which is important to everyone. So we want to thank Angela very much. And Angela, hope your summer's doing very well.
And hope you're staying well too.
Okay, thank you. You too.
Thank you.
Okay.
Okay.
All right, folks. Now I'm just going to give up the our news update. Before I do that, and I'm going to click on this first, since we're running a little ahead of schedule. Do we have any elected official representatives on our system? Who is 718-436-7600? Please identify yourself.
Hello, it's Ursula from Family Connect.
Okay, hi,
Hi,
family. Hi, Ursula. I'm going to
Okay,
mute you.
good
I'm gonna-
morning to
Good
everybody.
morning.
Thanks.
I just got to mute you.
Okay.
Now we know who you are.
Now we know
Thank
who you are. Okay, now I am going to just recheck and remind everyone. Do we have any elected official representatives who are on the screen at this who is on, or the phone people? Any of you are elected official representatives? You can please *6 yourself. Otherwise, we're going to move. Wait a second. Hello?
Hi, this is Sophie. Hi, this is Sophie from Senator Gurnardis' office. Thanks for
Hi,
having me.
How
Good
are you
morning,
doing,
Sophie.
Sophia?
It's Deborah and Christopher.
And how are you, Sophia?
I'm good, thank you. Hope
you have
you're
any-
staying dry.
Yes. Well, yes, we're staying dry here, but do you have any updates for Senator Andrew?
Yes.
No, nothing at this time, but definitely always feel free to reach out to our office with questions or requests. Our number is 718-238-6044. We're always happy to talk to you.
Oh, I have a question for you, Sophie.
And can you repeat that
Sure.
number again?
Yeah. First, give
Sure.
the number, and then I'll list my question.
Okay, it's 718
Mhm.
238 6044.
044. Okay, Sophie, right now, due to the fact of you probably have heard all the problems we're having with our direct care professions were not being paid appropriately. We do hope the senator is advocating for that change. And the other one is to please, I understand he's state, but you do work with your Congress and your two United States senators. We ask that Senator Gennars please work and see what ARC, the nationwide, that we need our Social Security laws for income and others updated and for services. So can you please pass that on? It's very important.
Absolutely, will do. I'll share both of those points with the senator. He does read notes from all of these meetings. I know he looks forward to hearing, what's on everyone's mind. So he'll certainly get the message. Thank you.
Yes.
And I hope you're going to stay, because we do have an update for you guys, because as you know, we do have a couple of things that are coming up that I will be mentioning. We also have another guest star here with us that he's going to help give me a little power boost. So I hope
it's really important, because remember, eventually we're going to Omni.
Yeah, as you know, we're getting ready soon to go to Omni, and we do need everyone's help on this, because there has been a lot of mixed communication. We want to make sure everything's getting the right facts. So I hope you stay with us, because we're going to do that in the next few minutes.
Absolutely.
Thank you, Sophie.
Does anyone have any questions for Sophia from the State Senator Andrew Ganales? And I just put on the chat their phone number. So if you're in his district, please give them a call. And you know that Andrew Ganales does have a lot of events that he's been doing, and I hope to see him. And he's been giving out masks, which I do want to thank him and Roxanne Prasad, both senators that have been doing really well. And I hope to see him this coming Wednesday, which I'll be mentioning in a little bit.
And Sophie, we appreciate all the support that Senator Ganales has given us. And please, everybody, if you have issues, please let them know. And by the way, you can contact also our Senator Ganales, who happens to be my state senator. I can contact him through Twitter, Facebook, Instagram, probably all the other.
Twitter.
I said Twitter.
I know. But you can.
He does answer you.
And Facebook.
Yes, absolutely. Thank you so much for having me.
Thank you
for being here. We appreciate it. Thank you. Okay. Now,
since we do not have any other elected officials joining with us, unless they're on the phone, you can unmute yourself, which is *6. If you're not an elected official representative, I'm going to move on, and then we'll get on to announcements in a little bit.
I just want to say one thing in reference to our local officials. If you have any issues with your Medicaid, Medicare, your SNAP benefits,
Or anything else.
or anything else, our local elected officials from City Council, State Assembly, State Senate are there to help us. And of course, our Congress people also. And of course, you can contact, our two United States senators. There's nothing too small and too trivial for them to be able to assist any of us. So please keep in touch with them if you have problems. It's an example if you're having issues, say like with the DMV, because they did not send you your non-driver's ID or regular license in time, and you did it, please let them know. That's one example. Also, please make sure everyone, please be registered to vote. It doesn't matter what party you're with, just register and be able to vote. Thank you.
Mm-hmm. Since now I'm going to move on to the news update. Reginald, are you still with me? Reggie Barron? It's hard to tell. Let me just peek before I proceed. Yeah, he's there. Reggie Barron, are you there? Okay. He might be might be listening, but he knows I'm here. But he's here as well. Let me give you guys some news update. It's Deborah give you partially the news update.
Wait, is that Reggie?
Is that you, Reg?
This is me.
Oh,
I'm
good.
here.
Okay, well, that's even good. Stay where you are, or should I say, because
there you are.
Because,
good to see you.
Because Reggie, you're gonna give me a little. You're gonna give, since you're here too, as Reggie is the other special guest star. But before I can,
ready, Reggie?
Hold on. Someone is making a noise. I have to remind the 347-663-2542. You must be on mute.
Thank you.
Okay.
Are you ready? Are you there, Reggie?
Yeah, he's there. I can hear him.
I know, but I want to make sure.
Yeah.
I'm ready.
Yeah.
Just This is Audrey.
Okay, Audrey, and we heard you, but right now we're
I'm glad you're here, Audrey,
I have to mute you.
temporarily.
Yes, because
So
right,
this is very important for everybody to hear, and I'm saying as the
Okay.
chair of the advisory.
All right.
I want everybody to please listen to Christopher and, of course, Mr. Reggie Barron.
So I am going to remind everyone, please stay on mute button. If I mute you on the phone, reason is can't have too many echoes and everyone must hear me very clearly. All right. As you know, we're doing today is a news update, which this is important to everyone. First things first, reminding you, our percentage on our website has gone up higher than we ever did. And if I say the numbers now, it's going to be like below everyone. But I do want to thank everyone who's sharing that information. Yes, check the website for news updates for other things and may give you some great tips as well. So make sure you visit that website always. Now, regarding, as Angela Blay and Deborah mentioned, coronavirus, if you need to find a vaccine site, there are so many directions you can do. You can type in vaccinefind.nyc.gov, and they will click. You can click on your zip code, your address, and find the nearest one. You can also visit our website /COVID-19 or go onto the news update page. So you do have more options to find that as well. Please make sure everyone you are vaccinated on that as well. It is very important. Carrie couldn't be here today, so Carrie has shared me this. The Brooklyn Public Library Include Service is having their 10 Adult Brooklyn
Exceptional
Children's Resource Fair, which is October 2nd from 11 to 3 at the Central Library Plaza. For more information, please contact Carrie Banks or go on to the Brooklyn Public Library, brooklynlibrary.org. This is October 2nd. Yes, it's on a Saturday. I don't control the dates. I just read it. Now, a lot of you have been asking me this question also, and this is for a lot of everyone who's on today. Please make, if you have not, say like not today because it's raining, or I should say stop now. Please find some good events during the month of August. Visit the website for any other events you like to take your son, your daughter to do. For example, the Suffolk County Farms is still having their events, not until maybe starting tomorrow, but they still have really good events coming up there. We have the 18th Avenue Festival,
Santa Rosalia Festival, the feast, which will continue
until August 29th. The Brighton Beach Jubilee, which you guys have been asking me like for months. It's still on August 29th down at Brighton Beach.
It starts approximately at 10 a.m.
It's supposed to start at 10 a.m., but you know people like to get there early and they try to end at 6. But also remind you, we have the Coney Island fireworks still going on. That will start on, since this week is the 27th is coming up, it will start at 10 p.m. because of the Brooklyn Cyclone game. But then the next day, on August 29th, but also the next day, there will be another fireworks show, which will be on Saturday, which will be the August 28th from 9 to 9:30 p.m. when the games are finished, and you'll see those fireworks. So if you need to find it for events, please visit the Google webpage, or please go into nyc.gov/events. That's the best way to find out more events that are coming up in the near future, or the month of parts of the end of August as well. Now, to everyone, yes, the Transit Museum has reopened. The visiting, you can please make sure you visit the website at thetransitmuseum.org/visit. Because there are changes, you still have to wear a mask. And the prices are very easy to do. You must set up a reservation. For adults are 10, children from 2 to 17 is $5. A person with a disability is also $5. And they have codes and stuff. If I explain all the codes, we'll be here until next year. But one code for disability is welcome, and that will cut it down. They will ask you to please make sure you have a reduced fare Metrocard, accessoride, any kind of a disability card that you have. Official card. So please make sure you have that. And to remind everyone, you must wear a mask there. If you have any questions, please find out from the Transit Museum for any other ways. which the only thing I will say is they might let go if it's regarding a face shield. That you need to contact them at this time. Reminding everyone that some of you have been asking me this question, and Reggie can vouch with me on this too, because it is related to the MTA and all public transportation. You must wear a mask. It is the law. There is no exceptions on the bus or on a train car. If you're on the outside stations, like example, if you're on New Lights Avenue and the train has not arrived to the platform, you do not have to put your mask on until the train arrives into the platform. If you're getting on that train, it's already in the platform, please put on your mask before you enter the train. As you know, trains do get cleaned and disinfected before they leave, if they can leave on time. If you refuse a mask from the NYPD or anyone, the fine will be $50. You must wear a mask. And Mask Force will be joining again this Wednesday, August 25th. You can click on to Mask Force and you can find out where they're located. For example, for East New York, there will be a Broadway Junction. For downtown Brooklyn, there will be an Atlantic and Coney Island Stillwell Avenue. Coney Island Stillwell Avenue means we can go up on the Q line up to Newkirk Plaza, the other on the F to Church Avenue, and the N and D train by 36th Street. Anything going in Bay Ridge is Atlantic Avenue. We have nothing to do with Bay Ridge, but Bay Ridge is Atlantic Avenue, and you can start from there and stroll down on the R line as well. So please make sure if you're interested, come on down. There are different tours. You can do it 2 hours and 30 minutes, and it does help to yourself with people. Now, Reggie, are you here still?
I'm still here.
Okay. Since you see my screen, can you want to explain this?
Okay, good morning, everyone. My name is Reggie Barron with Mobile Sales. That's the outreach team for the reduced fare Metrocards, seniors, and people with disability. The reduced fare program is available for those 65 and over, and for those under 65 with a qualifying disability. And you can use it on New York City buses and subway, Nice Bus, Westchester County Bus, Long Island Railroad, Metro North, and Staten Island Railway. You'll present those as an identification for the commuter lines. And on the express bus and the commuter lines, it's available during the off-peak hours between 10 and 3 and after 7 weekdays. So the applications that you see here now are the page 1 for both. On the left is seniors 65 and over, and on the right is for those people with disabilities under 65. If you're already a reduced fare customer, please provide us your email, which you see at the bottom of either page, because as in the future, we are going to change the fare card system to the Omni card, and this will help us communicate with you and provide you additional information as things go along. And as you see, Chris has put the website for the Brooklyn Family Services on there so that you can access the application there as well as the mta.info. Okay. So if you need to find the mobile sales vehicles, which will assist you in intaking these applications for those, again, who are already reduced fare customers, we'll gladly assist you by updating your information. And you can see the website there where it says Metrocard buses and vans. And then the website just below is where to obtain the application, and you can fill out page 1. For all others who are just applying for the first time, please do visit the mobile sales vehicles, as we will assist you by completing the application for you. You'll bring proof of age for those 65 and over. For those under 65, and thank you, Deborah, for explaining the difference between the Medicare and Medicaid. With Medicare and photo identification, again, Medicare and photo identification, and you apply for people with disability, you'll receive a temporary card at the mobile sales vehicles. So 65 and over, proof of age, or Medicare with photo identification. Once you receive the temporary card, you can add value at the vans or buses, and you'll be ready to pay the $1.35 on the day of the visit. If you have any difficulties with your cards, we will assist you as well at those vehicles. You'll provide us your damaged card, and we will complete a form, provide you a receipt and a temporary card. You can also add value at that time and continue your travel at the reduced fare rate of $1.35. For lost or stolen Metrocards, there's a new policy that started, and that was on the 16th. If you have lost your Metrocard, you can come to one of the mobile sales vehicles or 3 Stone Street, and upon verification, you'll be issued a temporary card. Again, that's new. It was not a policy before, but we've updated the policy, so you can actually get a temporary card if you lose your Metrocard. They'll go through a confirmation process, and then we'll fill out a form if you're at the vehicles and issue your receipt. Okay. I think that's the latest and the greatest information there.
And just to add one thing to Reggie, the mobile sales bus and vans do accept cash only. So
Yes.
for people who have been asking about this, as of Reggie, you can give the date again when you guys accept.
June 21st.
June 21st, the cash was accepted. Now, remind everyone that at this moment, as you know, we are going to be switching soon. Those machines at those train stations are going to be updated soon to the ultimate recharge. Means not just going Long Island Rail and Metro North, but subways and buses, as well as accessorized. Those machines will also be separating to the Omni card and as well as stores as well. But it is important to everyone that we need everyone to do their part to please update their information. For example, agencies who are here today, it is a great idea to please get your day have groups. If they already have a reduced fare card today, they should be update their information. We do not need pictures. Am I correct, Reg?
That's correct.
Mhm.
If you're already a reduced fare customer, no, just the application there. If you want to update your information, a picture is not required.
Yeah, and that's what makes it easier. So please make sure that you follow up. As Reggie told you, once if you have a pile, just please put it at the reduced fare vehicle as well. The address that is on those applications, you can still mail it to them, but make sure you make a copy of it. So therefore you have the duty noted on your end as well. It is very important so we can keep this information and all your information is up to date, especially an email address as well. So please make sure you visit the new mta.info/accessibility, or it doesn't matter if you're going to Metrocard and bus and van, all their information from accessibility is there, including accessorized as well.
Yes.
So Reggie's not moving anywhere. So Reg, don't move from where you are.
No, I'm just going to mute.
Okay, that's fine.
Thank you.
So to remind everyone also, system-wide accessibility, and her name is Sarah Berry. You met her many years ago when Bfssac came in. She's going to be doing soon a Zoom. She's going to be asking agencies who is interested to do the Omni presentation. They will explain what the Omni presentation, what the new Omni is going to do for the near future. You're going to have more options, more access, not just a card, but as well as on your cell phone as well. To find out more about that, please email her, ask her what dates can she do. She's not doing it until October. So you do have time, and you don't have to switch to the card immediately. The only thing that Reggie and I are both asking is to please update your information. When everything is done or ready is your choice. You can do it starting in October, or let's say the fall, until 2023. As each level goes up, the more up it goes, the more reduced fare Omni will go on, as well as the regular Omni. A lot of you can still do your Omni today on your full fare, which you can combine that with your automatically your app on Google and Apple Plays. So anyone who has those, please make sure you visit our website /transportation page. As you see, these applications are always located in our website on the transportation page as well. And it doesn't bother anyone. Now, somebody's been asking me this question. As you know, that MTA did celebrate the ADA 31, which is the American with Disability Act. And you'll see here that A, a new accessory vehicle, B, a new R211. So in case you do see it, it is right now at the Pinkin Yard. As well as the new MTA buses that are coming into the area of Brooklyn, partial Queens at this moment, and they may be already in the Bronx. I have to see. These are the new electric bus that you barely can smell, but there's a lot of new updates that is coming in. So I want to remind everyone, ADA 31 was on July 26th. As you see, MTA has been updating a lot of new accessibility features. Omni is one, the new subway, accessorized, and buses. As you know, we also did do part of ADA 31. We did dedicate one elevator to Edith Prentice, a legendary advocate for people with disabilities. So this is what's been going on in the summer of ADA 31. We do want to thank the MTA, especially Reginald Barron, who is always on a mission, as well as his team. So just to let everyone know, things that we're doing now, it's going to change that has never done before. And for you guys to soon in the future ask me this question, and Reggie can answer this question right here. Reggie, is the reduced fare vehicles not leaving, correct?
They're not leaving.
And you heard that.
Yes. No, we're going to be, heavily involved with the new promotions of the fare card system, which is going to be the Omni. So we're not going anywhere.
That's correct, folks. So,
yes, there's one thing though, Reggie, I want to let you know I plan to advocate for you guys to have more vehicles and more sites.
Thank you.
I ask everybody on this call, in this video conference, to please do that. And let the elected officials know we need that because it's a major help.
yes. So as you know, now I'm going to remind everyone, some of you guys came in late. Once again, there is no meetings in August or September for the full joint meeting. The next joint meeting is not going to meet until October 27th of 2021.
Next.
And I'm going to remind everyone, we try to start on time. So we make sure, because we might have speakers, we might have representative elected officials, we want to make sure, as well as OPW updates, as well as the IAC updates, and Department of Health and Mental Hygiene. Because there are times we need to make sure that their time and everyone else gets the good information. And yes, this is always recorded to let everyone know that so if you miss something, you can always reverse back on this. Now, with all the questions, before I proceed with questions, Angela, you have something to follow up? Angela?
Yes, I do. I followed up with my supervisors, Nina and Lucille Macy. People entering the building, we are not accepting anybody in the building at the moment without an appointment. You asked about the vaccine. We have not requested that at the moment because there are still staff that have not been vaccinated.
Okay.
So until we get an update from Albany, this is the procedure for now, but I made sure I followed up on it too.
Thank you very much, Angela. I appreciate that very much because I don't want people to show up and be turned away. I want everyone to understand that we have to make appointments due to COVID-19 and the Delta variant.
Yeah, they have to make an appointment. I mean, we will accept people in the building on for special reasons, but they have to make an appointment and get an approval from us to come in first. We can't just, come up like we used to.
That will be constantly put on our website and in other places.
We'll make sure of that. But Angela, since I have you here, do you have any questions for Reginald Barron or me?
No, I'm good.
Because since you were here first, that's why I'm asking first.
No, I have no questions.
Okay.
I'm just, listening and.
And just to let you know, Angela, anyone who has, just to let you know, because some of your staff have been asking this, if you guys get the transit card, used to have been the transit check, now it looks like a credit card kind. Like it's called, like I call, you can combine that with your, and I'm just sharing this with you as well as everyone. You can combine that with your cell phone. That means you can program how much you want to put in the card. Like you can go on subway to bus and bus to bus, like normally like you do a gold metric card. It does count as a transfer, but just let everyone know, right now, for the full fare people, you do have an option with your credit card. The transit card, you can combine that into your app and go, boop, you're on the bus, boop, I'm on the train.
I do have a question for you, actually.
Yes.
Is the bus going to drop people in front of the building, or where is the drop-off site now?
Right now, because due to they're using that site for the COVID testing at 88 Fountain Avenue, they were supposed to be notifying not just me, but they're supposed to notify DOT so we can then refix the bus stops.
Oh, okay.
No, and I'm glad you're bringing it up because right now they are going to be readjusting the buses because once that site is done, all buses will be on Vandalia in both directions. The 84 might have to be readjusted, but there is also just to let everyone know, and I'm glad Angela's bringing this up. Bus redesign is going to recontinue this coming fall for phase 2. So, for example, for the first draft, they were supposed to be adding 3 more buses. Another Queens bus that's coming from Cross Bay, normally it's be called the Q112 bus, will be going on to the belt and get off at Erskine, so it can terminate also. So because of the higher ridership in the Gateway Mall and the housing development they've been building, the ridership over there has increased by 20% more. And possibly we're going to see a lot because since that mall has been very crowded thanks to ShopRite, they are going to maybe do some more adjustments in the future. We'll have to see what they're going to do.
Okay.
With that. But right now, they are supposed to be rechanging the bus routes. And bless you.
Bless you.
And once I find that out, I will forward that to you, Angela, as well as to Lucy Amazing, because I did promise to let her know. But at this moment, they're just announcing the redesign. Bronx is just finishing up their redesign, and they have to still have a meeting this coming fall. We're in phase 2 now.
Okay. Thank you.
No problem.
You're welcome. Thank you.
Does anybody
have questions for Angela too?
Does anyone has any questions? Period. Right this moment. I see. Who is KESSIE?
How you doing? Cassie Dixon here.
Okay.
And you're from?
Where you from?
Jewel Human Services.
Okay, Jill. Now, do you have a question? Because your mic is on.
Okay.
No, sorry about that. No question at this time.
Okay.
Okay.
Just want to make sure.
Okay.
Thank you, guys.
Okay. All right. Does anyone have any questions for Reginald or me at this moment? But before I do that, I'm going to ask the phone people also. So this will give you guys a little time. But I know there's one person that's been itching. Ursula, where are you? Show me.
Oh, you have a question, Ursula?
Because I have a hunch. Okay. Does a representative from Sophie, do you have a question for Reginald Barron or me?
No questions right now. Thank you.
Not a problem, but you saw you heard what we were saying about regarding, Reginald Barron, as you know, that we'll be soon transferring to the Omni card in the future, but we're also reminding everyone to please update their information.
I have something.
Yeah.
Sophie, this is Deborah Gray. I would appreciate, please let Senator Bernardus know that one, I would like him to fight to get more funding for more of the Metrocard vans, which will eventually be turned to Omni vans. But I would like to have more of them around, and I also would like your office to make arrangements to host it or have it once or twice a month and have the other elected officials do. But please, all of you have to fight for more funding because it's so much easier for for seniors and people with disabilities to get the help they need when they can go right to those vans and buses.
Absolutely. Yeah, great point. I'll certainly pass it on to the senator today.
Thank you very much.
Thank you so much. Let's see. I don't know who is 7-1. Oh.
Yes,
Hold on a second. Audrey Peterson, do you have a question? Because I can neutralize you from your phone number.
if you have a question, please let us know, dear.
Okay. Is this Ursula that's off the mute? 718-436-7600?
Yes, it's me, but I'm on the phone from the strange location. I don't have any question. Thank you.
Okay. Okay. So let me check. So does anyone have any questions on anything? Or I'm going to remind everyone, do you have a question for Angela Blaze as well? You can still, bring it up now, or you can do it during the announcements at this present time. Also, I'm going to remind everyone that it is not this hard to please make sure that everyone's information is up to date. Doesn't matter, but if you have service openings, I'm going to remind you that now. Also, is please, folks, please, if you have any service openings, trainings, events, or any new updates, you must email us no later than this Friday. So please make sure that it's in. If you have some events or trainings are coming up, please send it to us. Please do not try to send us to short notice, because that means that's a waste. It should be like a week's notice, so therefore families can know ahead of time. So I'm going to ask, does anyone have announcements at this present time? Also, do I have to, let's see. Valerie from Mercy Drive, do you have an announcement?
Hi, it's actually Vanessa from Mercy Drive.
Sorry.
No, it's okay. Don't worry about it.
Oh.
I actually have an announcement for our Day Habilitation Without Walls program. We are currently accepting new individuals for our Brooklyn site. Chris, I will send you the flyer in the email if that's okay for you to.
That's fine. Make sure it's on PDF.
Yes, I will definitely do that. So thank you. That'll be all.
Thank you.
Thank you so much. Does anyone have any questions for Vanessa from Mercy Drive? Okay. Then I'm going to move on just to see. Ursula, do you have an announcement? Ursula, you can *6 yourself. Ursula, you can speak now. I unmute you. Okay, Ursula is not answering, so I am going to see. Nick, do you have an announcement? Go ahead. Your hand's up.
Hello, Nick Labruna here from Partners Health Plan. We continue to enroll people into our plan. If anyone has any questions about what we have to offer, please reach out to me. And we continue to focus in on, getting people vaccinated, and as well as providing, getting more providers into our plan that do provide in-home care for people that are unable to get out of their homes. I will put my number in the chat and my contact information. Does anyone have any questions?
Yes, I do.
Nick, Deborah Gripe has.
Go on, Deborah.
Okay. One, you still have it. All right. Say an individual with their family signs up with you, but they have two specialists that are at, say, one's at Coney Island Hospital, the other one's at Lutheran. Do you still guarantee those individuals can see their specialists, or is there would be a problem?
The hospital and doctor has to be in our network of providers. So we would have to check those doctors themselves. Certain doctors have admitting privileges with certain hospitals, sometimes more than one. So sometimes there's a workaround if their hospital network isn't in our network. But that we'd have to look at on an individual basis.
And the other question is this, Nick, can you hear me?
Yeah.
Okay, Nick, in emergency, because if say an individual was in an accident and they go to a hospital that's not in your network and they're taken in by ambulance with 911, how is that handled?
We would cover that regardless. You know, we're not going to leave anyone with any bills or anything like that. Our members never pay any fees, so you know those emergency things we'll take care of.
And you have a good contact with the FDNY, and I say this for the reason is that FDNY, even if you give them all the correct information, somehow it slips, and then for the next 4 or 5 months, the family gets bills from FDNY, and it happens regularly. That's why I'm asking you if also if you speak to the administrators with your agency to please make sure that FDNY is alerted about this, because they will take and bill the family over and over again, no matter how many times you send in the correct info.
Okay, with which organization you're saying?
Fire department.
The fire department.
You know, the EMS is under the fire department.
FDNY.
Oh, okay, the FDNY. Okay.
Yeah. I'm being very truthful because it's happened not just to me, but to many of the members and families. Emergency, you're taken to a hospital because you have to go, life or death. And the person that brings them gives them all the correct insurance information, where they live, what's going on. They make sure even at the hospital when they sign them in, it's the hospital that doesn't give them the hard time. It's the fire department, EMS. Can you please make sure with your agency and anybody else listening on this to fix the issue that the fire department is not paying attention to where the person's insurance is? And I've seen this happen. It's been happening for years. So I'm asking you, please have your administrators work with the fire department, EMS division. That's very serious because they'll bill you and threaten you with creditors, and it could be $1,000. The fire department. So please, that's why I'm bringing this up.
Okay, I haven't heard of that before, but I'll look into it a little bit further and bring it to the attention of people who need to work on that kind of outreach.
Yes, just be prepared. They're famous for that. Okay.
Sometimes they don't communicate with the other communication, because you know that a lot of the since they're using the apps now for hospitals, they've been updated as of July 1st. They sometimes take away, like say if something is updated, they might take away someone's insurance. They don't realize the insurance has been there the whole time. There's a lot of computer errors, so we need to be watch out. And this is for everyone.
Yeah, just be prepared.
Yeah.
That's why I'm bringing this up.
Yeah. Does anyone else have a question for Nick from PHP? Nick, thank you so much. And by the way, if you speak to Miss Anna, tell her stop being a stranger.
Just tell her we send our regards and thank her for all the hard work she's done for all of us too. And we appreciate you too, Nick. Thank you.
Okay, thank you.
You're
Thank
welcome.
you. Jessica Williams, you're still with us from Tri-County?
Yes, I am. Good morning, everyone.
Morning, Jessica. What, you have any major updates or minor, whatever? Just give us updates. We'd appreciate it.
Oh, she's turning on her camera.
Oh,
look.
there you are.
Hi,
Nice
good
to
morning.
see you. Good morning.
Nice to see you as well. Hope everyone's
Yes.
doing well.
Nice view.
So just basic updates today. Tri-County Care is continuing to help families to get through the enrollment process for OPWDD. Again, I didn't think I mentioned my name. So my name is Jessica Williamson. I am an intake and outreach specialist in Tri-County Care. I work with a large team of intake specialists who help families through the process. We also have at our company Medicaid specialists who help families who do not have Medicaid. So it doesn't matter where the family is in the process. We are able to help the families through to get the eligibility, get their level of care, make sure that they have Medicaid waiver, and then we make sure they get enrolled for the care manager. Please make sure that you check the inbox. I will put my information there so anyone can contact me. If you have questions about eligibility, any questions at all about care management itself, please give me a call. My extension is 9298, and you can reach the Tri-County Care number, which is 844-504-8400. And again, my extension is 9298. Looking forward to speaking to anybody who has questions for parents, or if parents want to contact me directly, please give them my number. And thank you so much for your time.
Thank you, Jessica. Let me check. Does anyone have a question? Wait a second. Something just popped up. Oh, just Nick. I thought Nick had a question, but no, Nick is putting his information also on the chat. So if anyone has an announcement, can also please put that on the chat.
We appreciate it.
We would be appreciated, because Jessica, as you know, I do put this up, but you guys are also Tri-County Care Design and ACA. I'm mixing up their names so much. Their information is also linked with the OPWDD page, which is scroll down and you will see all 3 CCOs as well. Okay, let me check.
Thank you, Jessica, for your information. We appreciate this very much too.
Let me see this. Ursula, are you back? Because I know I see your phone number there. For Ursula or anyone who's on the phone who has a question, you can *6 yourselves, which is to unmute. If you have a question or an announcement, please, let's hear your announcement. I see a Michelle here. Michelle, do you have an announcement?
Hi, good morning. No, I don't.
Can you just tell me what agency you're from?
Williamson Services.
Okay, and how is that agency doing?
How are you doing?
Oh, we're doing fine, thank you.
You have, so anything new we should know?
Pardon me?
Anything new?
Oh, no, not at this moment.
We
just extended the information that you provided to our families, so that, and I know some of them are on, so that they get exposure. And most of them are very interested in the booklet. So I will download and circulate as much as I can.
And also, Michelle, since you're also on the phone, I know Reggie's here too. Make sure that the families are updating their daughters or sons, or maybe they have a disability we don't know about. They must make sure they update their information, because it is important that we update every disability and disabilities and seniors, their information as well. It is important that we do that.
Okay, will do. I will send out an email to all parents. Because for some of the parents, I also indicated to them, those who could not attend, I would give them a synopsis of this meeting.
Yes.
So thank you very much.
Just to let you know, Michelle, this is recorded. It will be shown on the recording will go on later this afternoon, and it will be on the outreach page.
Oh, okay. Thank you. So at least they can sit and go through it on their time.
Yes.
Thank you.
So they didn't miss anything.
You're welcome.
You're going to enjoy the fun later.
Okay. Have a good day.
We can to make things easy for everyone.
Yes.
Oh, much appreciated.
You're welcome.
Welcome. All right. Since none of the human voices have a question or announcement, I'm going to check the cell phones. Now, I know a fact. I'm going to start on the bottom. 718-436-67600. Is that Ursula? Okay. You're off the mute. Okay. 718-436-7600. You're off the mute. Yes. Do you have an announcement, Ursula?
No, thank you.
Okay. No announcements? Okay. Now, 347-564-3743. Please identify yourself and press *6 to unmute. Hello?
Hi, good morning. My name is Patricia Ashton.
Yes.
I'm representing Mr. Leonard Charles for Gerard Charles, and we are from Jules Human Services.
Ah, so we got Jules here today. So we got a double dose of Jules today. That's good. Welcome. Do you have an announcement for your agency?
I'm one of the workers that's working with an individual, but his parents could not be on today, so I'm representing his parents.
Okay, that's fine.
That's fine.
That's fine. I'm just checking, making sure that I didn't leave anyone out.
Thank you.
No
You're
problem.
welcome.
Okay, and I'm gonna do the last number, which is I didn't hear from them, but I'm guessing I think that was RG Peterson, so I know that number. Since no one else has an announcement or a question, I'm just gonna ask. Jackie, do you have a question? Announcement?
No, I'm okay. No announcement here. Thank you, though.
Okay, thank
No,
you.
just making sure. Just making sure. Okay, since no one else has an announcement, just going to remind everyone. Hope everyone enjoyed the presentation. As a reminder, we need your assistance even today until the fall. Very important to remind everyone that as you know, we do not meet it. The advisory and the DD are not meeting this month or September because we have a lot of holidays, and B, first day of school. Please make sure the next joint meeting is not until October 27th, which I'm going to pop up on this screen. Again, October 27th is the next joint meeting. The code will be resent out. You can always check the email, the website. That will always tell you when the meeting code will be coming. This recording will be ready by this afternoon, as to remind you, and you can check the screens from there as well. Now, remind everyone, some of you did come in and out or came in late. Reminding you, this is all for the phone people. Please make sure that you get a copy of the page 1, which is right here. These 2 pages are the page 1. You do not need a picture. You do not need, you just need to make sure their name, their last name, their phone number, and email. And if they don't have an email, help them create an email. Now, if a person does have a Cesare email, you can combine that with that email as well, because it's still related to MTA as well. And I remind you, Sarah Barrett will be available to do that as well, and it will help everyone. So on behalf of the Brooklyn Advisory Council Special Outreach Update with
Deborah Greif, Chair of the Advisory Council, we thank you.
And we want to thank everyone being here, and we'll all see you in October. Happy rest of the summer, and see you this fall. Thank you, everyone.
Thank you. Bye.
Bye-bye.
Thank you. Bye-bye. Thank you.
Bye.